Many doctors, practicing dentists, have started practicing corticobasal implants. There are many benefits of why the doctors has to start practicing corticobasal implants. Here are the few things we should keep it in mind. So to know about why you have to start practicing corticobasal implants, even though you are a conventional implant practitioner. So corticobasal implants have an edge compared to conventional implants in many aspects, like uh, the time required to complete the treatment. For example, in conventional implants, after placing the implants, you need to wait for 3 to 4 months for osseointegration, or there may be added surgical procedures like grafting, opening the flap, or replacement of the membrane, and waiting for the integration to happen. Usually, it may take 6 to 8 months also. Whereas in corticobasal implantology, we need not to wait because we place the implant in the cortical bone, which is the infection-free bone, which is below the cancellous bone. So we engage the threads of the corticobasal implants into this cortical bone. So this bone is 96%, 96 to 98% is infection free. Usually after the placement of the implant, usually there won't be any failures or any infection for that matter. So compared to conventional implants, for a particular cases like diabetic patients, or if there is a CGP cases as a chronic periodontitis case of the pyorrhea, in all these cases, to place a conventional implant, you have to make the bed ready, means infection free. So the bone has to be infection free. That you have to do debridement, and you need a lot of all other medicament procedures, grafting, all those things. Whereas in corticobasal implantology, even though for the diabetic patients, I mean the controlled diabetic patients and also the chronic periodontitis cases, we can place the implant. Since we place the implant in the cortical bone, that is the second cortices, which is infection free, and this is the bone which will live long, means it will be there till the patient's the last life. Here there won't be any problem for the patients who are undergoing treatment. It means the patients who are controlled diabetes as well as chronic periodontitis cases also can undergo corticobasal implantology treatment. So in this way, so corticobasal implants has an edge compared to conventional implants. Other aspects to be considered here is the total treatment period. Here in corticobasal implants, we are going to finish the implant in 6 to 8 days, or sometimes 3 to 5 days, depending upon the patient's condition. So usually it will take 1 day to place the implants. Next, the prosthetic procedure. Next, the prosthetic step may be the immediate functional loading with hybrid denture, or you can go with the PFM processes or the zirconia processes. It all depends on if the case is immediate extraction case or it's a ready case without extractions, all those things. We have to take many things into consideration before deciding which process is to be given to the patient. Okay. So all these processes together will take a maximum of 3 to 5 days. That's why we call it as an immediate loading implant technique. Since it's an immediate loading implant technique, especially in full mouth rehabilitation cases, there will be equal distribution of the forces. I mean the occlusal forces all over the implants. So in the complete arch, so since the implant will be stable and rigid, so after the castbar fixation, this equal distribution of occlusal forces or the occlusal load will be observed by the bone properly, so that your implants will be stable and it will give long life. So this is an advantage in corticobasal implants, usually in full mouth cases. So most of them started doing corticobasal implants. Are the till technique is also good, wherein 4 to 6 implants in the upper and also lower, also 4 to 5 implants. So you can give the full mouth processes. We call it as a full mouth rehabilitation cases. So when there is an atrophy, so corticobasal implants again play a major role. When there is an atrophy, usually atrophy happens in aged patients, wherein the bone will be reduced in height and width. So here you cannot place the conventional implants, especially in the lower during the atrophy. The inferior alveolar nerve will be closer to the crust. In such cases, it will be difficult for you to decide the size and length of the conventional implant. Here in atrophied cases, we can easily place the corticobasal implants because we do narrow bypass technique and we place the implant till the base of the mandible. And also in the upper, in atrophic cases where the pneumatized maxillary sinus will be there, we can place the implant anterior to the maxillary sinus and posterior to the maxillary sinus. So that is anterior to the maxillary sinus, that is angulated towards the midline, that is to the nasal floor, and the posteriorly, that is towards the that is pterygoid plates. We can place the implant. So that is we can make use of the posterior wall of the maxillary sinus and place through the tuberosity. We can place the tuberopterygoid implant also. We can place directly into the pterygoid. So we can place double pterygoids or single pterygoid depending upon the case which we have chosen. So these are all the advantages in atrophied maxilla and mandible where the corticobasal implants play a major role. So go for the corticobasal implant technique instead of regular conventional technique when there is atrophied jaws. So these are all the advantages of corticobasal implants. Along with that, the patient anxiety and the duration of treatment, making the patient at ease during the procedure and after the procedure, and taking care of the patients after the completion of the procedures are all the simple techniques here in corticobasal implants, wherein we call the patient after completion of the treatment, and also after completion of the treatment in full mouth rehabilitation cases, patients start having food with the processes in. So they won't be feeling much of difference. They will start eating on the soft diet, then slowly they will switch on to the hard diet also. So whereas in conventional implants, usually conventional implantologists will do all on 4 or all on 6 techniques. In all on 4 techniques, there will be cantilever effect, since you place the implant till the premolar. Beyond that, you will give the molar teeth, that is the cantilever effect. That is, so the chances of failure is there in all on 4 technique. All on 6 have done, that is okay. So all on 6 holds good. So other techniques, what we can rely on is tilt technique is good now, wherein you make use of nasal floor as well as the pterygoids in tilt technique, that is 2-piece techniques. Even that is booming. I mean, tilt technique is also good. So compared to the regular conventional implants, corticobasal implants and the tilt technique implants are giving a boost. I mean, giving a major influence for the treatment in atrophied jaws or the single tooth missing or the multiple tooth missing. So it's a ease for the patients. When coming to the treatment period as well as the technique sensitive part. So here the corticobasal implants are technique sensitive, since you have to be thorough with the anatomical structures in the maxilla and mandible and in the pterygoid region. So if you are thorough with the anatomical structures, you can place with precision the implants in both maxilla and the mandible. So whereas in conventional technique, wherein so anatomical structures will limit your implant placement to maybe 16 to 18 degrees, 16 to 18 mm length. So here in corticobasal implants, we place lengthier implants of 26 mm, 30 mm or sometimes 35 mm also we place. So when in atrophied the jaws, where you are even the nails, sometimes the pterygoid implants you are not able to place. So doctors started placing zygomatic implants where they will take the support from the zygomatic buttress and place a quad zygoma on both the sides. So taking that suppose you can treat the atrophied maxilla. So even that technique is also happening and it's good also. So these are taking into all these things into consideration, and the patient comfort level during the treatment and after the completion of the treatment. So corticobasal implants and the tilt technique implants are very important, are the preferred choice when you do full mouth rehabilitation cases. Thank you.